I'm Dr. Allie Broyles. I'm one of the surgeons here at Rood and Riddle. I'm originally from Tennessee. Went to vet school at Texas A&M, and then did an internship here at Rood and Riddle, and then a surgery residency at Rood and Riddle as well. And I actually just recently came back to the practice a couple months ago. So for the older horse, I would kind of start considering the simplest things first. So want to make sure they are in good body condition, that they're not overweight. In older horses, what we think of most commonly is that they're developing some arthritis. So any excess weight will probably put some undue stress on those arthritic joints. Another thing to consider is their workload. You know, older horses hopefully are going to be more experienced, and so they don't necessarily need the hours of training every week that the younger horse requires. So just consider that you need some level of fitness, but don't overtrain those horses. So if the horse is a bit overweight, you know, you might, especially in older horses, you might see some kind of fatty deposits over their rump or some crustiness in their neck. A little bit of being able to see their ribs, you know, just the very faint outline of it is okay. It is better for them to actually be a little bit underweight versus overweight. And one thing we talked about too, if they're not enjoying their job maybe as much as they used to, that may be a sign that maybe they don't need to work as hard as they did when they were 6 or 7. And then, yeah, those horses are going to show some signs of soreness, maybe towards the end of a ride, or towards the end of the ride, just act like they don't want to do their job as much as they used to. So really, I would just focus on exercising them to the level of fitness that they need to be for their intended use, and make sure you're not exercising them to train the rider. So one of the places to start, if your horse doesn't seem to be enjoying his job as much as it used to, is doing a lameness exam to figure out if there is some pain or lameness issue that is causing that potentially behavioral problem. So with a lameness exam, you know, talk to your local veterinarian or a veterinarian that specializes in lameness. Typically, for a typical lameness exam, what we do is watch them jog in both directions, hoof test both front feet, palpate all their joints, ligaments, tendons, and then do specific joint flexions that might point us to a particular joint that might be painful or have some arthritic signs. And then following that lameness exam, we might do more diagnostics. So, you know, if the horse flexes sore in its hocks, then we would do more diagnostics such as x-rays or radiographs to see if there is evidence of arthritis that we could specifically target for treatment. Kind of the simplest thing to start with for treatment of osteoarthritis, one would be an oral joint supplement. These joint supplements, typically the ingredients are similar to what is available for humans. So glucosamine, MSM, chondroitin. The problem with the oral supplements in horses is there is some controversy on whether or not they are absorbed appropriately in the horse and if they truly are effective. As a joint supplement, I often recommend Adequan, which is a intramuscular injection. That way I do know that the horse is getting it. And it obviously depends on the owner's comfort level in giving IM injections. But there's also some data out there that tells us that it does work. And how it works is it is an anti-inflammatory for the joint, also improves lubrication of the joint, and then it potentially could even help repair cartilage. And we do know that it actually makes horses feel better. There is data to show that lameness scores improve after given a treatment regimen of Adequan. So those are probably kind of to treat overall arthritic pain or soreness. And then when after you've done your lameness exam, you find a particular arthritic joint, like the hock, then we would go to intra-articular therapies such as corticosteroid injections or even orthobiologics such as IRAP. Another thing to consider in the older horse is, you know, Cushing's disease or insulin resistance. Using intra-articular therapies with corticosteroids could increase their risk of developing laminitis. So that's when you might consider using orthobiologics such as IRAP. IRAP stands for interleukin receptor antagonist protein, and it's a natural product, so it comes from the horse's own blood. So how it's kind of harvested is you take blood from the horse, incubate it overnight in some glass beads, and those glass beads amplify the interleukin-1 receptor antagonist protein, which is a inflammatory, it blocks the inflammatory cytokine that actually specifically causes arthritis, and is very safe to give in the joint and for older horses with arthritis. I mean, another thing to think about, Equiox is a non-steroidal anti-inflammatory similar to bute or banamine, not necessarily as potent, but is safer to give long-term. So a lot of times, just for generalized soreness or generalized arthritis, we will prescribe Equiox to be given kind of for longer durations, maybe once a day for a month. It's still good to give those horses kind of a washout period where they're not on Equiox, but it is safer to give kind of long-term than bute or banamine.